As a reminder, from here on out, we'll have a once-a-week Wednesday at 1 o'clock press conference. Last week we were every day, but that was a special week. So we're here today, Wednesday at 1, and every Wednesday at 1. So we will begin with the data, as we always do. It's a good news story. Yesterday we performed over 5,000 tests and saw a percent positive of about 1%. So that is good news. We're continuing to see percent positive rates consistently below 2% and many days even below 1%. So that is great. Many states around the country, some are in double digits, many are above 5%, so to be at 2% or below is a very stable and safe place to be. Yesterday we saw 54 new cases, again a low number, especially considering we tested so many people. And very sadly though, yesterday another 3 deaths. So we continue to lose people every day, which means we have to continue to be vigilant and follow the rules. We now know, we've been at this for 6 months, we now know what we need to do in order to keep ourselves and our loved ones safe from this virus. And the challenge is doing those things, following those rules. But please continue to follow the rules, even though I know it's getting old, because that is what is necessary to keep a lid on the virus, save lives, and make sure our hospitals aren't overwhelmed. We have a few announcements today. I'd like to start off, as I often do, with the report from the weekend. Obviously, it was a Labor Day weekend, 3-day weekend. In general, thank you for what you did over the weekend. In general, throughout the 3-day weekend, we saw much better compliance with the rules than we did over the 4th of July weekend, and that is good news. Out of nearly 700 businesses, employee mask wearing remained around 96%, and customer mask wearing at about 93%. Those are good numbers, but we can't let up. We have to keep it there. So please continue to wear your masks. As Dr. Alexander Scott said last week, masks are one of the most effective tools that we have to stop the spread. It's pretty easy, it's convenient, and it's highly effective. We had our Department of Health staff out over the weekend passing out masks. Thank you for your hard work. They handed out more than 2,000 masks at gatherings, in parks, at beaches, at parties throughout the weekend. Thank you. I also want to acknowledge our restaurants and bars. Restaurants and bars have really stepped it up over the past week. Thank you so much. More than 94% of the bars and restaurants that we inspected had customers properly separated from bartenders. That is a huge improvement, and I cannot thank you enough. 93% had no mingling in the bar area, and a full 99% complied with the requirement to close bars by 11 o'clock. I just have to pause and say thank you. Thank you to the bar owners. Thank you to the restaurant owners. I know this has been really hard on you. I've talked to a lot of you. We hear from you. I know it's very tough, but I want to thank you for doing the right thing. It's clearly making a difference, and I want to say thank you. So to all of you out there who follow the rules over Labor Day, which is the vast majority of you, thank you. It's going to show up in our data a month from now. It's going to allow us to get these kids back to school more safely. It's going to allow us to keep businesses open and keep this economy going. So thank you, everybody, for a good Labor Day weekend, and let's keep it up. The one area that we do need to continue to work on is symptom screening. Only 85% of businesses we inspected last week were conducting health screenings at their entrances. That's pretty good, 85%. That's better than what we've seen in the past, but it is not enough. That should be 100%. That's something we know how to do. It's not that hard to do. We just have to do it. And we know that people who are symptomatic, have a cough, sneezing, feel sick, are more likely to spread the disease. So please, in business, at restaurants, please check symptoms. You can take someone's temperature, ask people to sign something, try a little harder for the symptom screening at businesses. Okay, in that spirit today of symptom tracking, I want to talk about a new tool that we have developed to make it easier for business to screen symptoms. And it's a tool that many of you already use on your phone. It is the Crush COVID app. I'll say 82,000 Rhode Islanders are using the Crush COVID app. I think that's great. Using the app is and always will be optional, but if you haven't downloaded it, now is a great time to download it. And today I'm excited to announce that there's a new update to that app that's available as of today. It's currently available for download at the Apple App Store, and later this afternoon it'll be available on Google Play as well. The new app does a better job of not draining the battery, and also includes some new, very useful features that I want to take a second to talk about. So the first thing is it will prompt you on a daily basis to talk about your symptoms. It's something that happens. I do it every day. It takes a second. But starting today, after you complete your daily symptom tracker, you're going to get a screening page with either a green smiley face, meaning you have no symptoms, or a red unhappy face, indicating that you should stay home. This tool can make it much easier for businesses, restaurants, bars, schools to do their health screenings, and will make it quicker for all of us. So rather than answering the same set of questions everywhere we go, you can simply hold your phone up and show your green smiley face for that day from the Crush COVID app. We're going to be working with businesses in the coming weeks to work with them to implement this, but hopefully this will make it a little bit easier on businesses, on schools, on all of us. So again, if you haven't downloaded the Crush COVID app, I'd ask you to think about doing that today. As of today, it's been updated, and there's a new, very easy to use symptom tracker. And if you do it every day, you'll only have to fill out a symptom tracker once. So, now it's a little bit more difficult if you go out to eat, if you get your hair done, if you go to work, you have to keep filling things out. If you do this app, you fill it out once, you show your green smiley face, and you should be cleared. In addition, starting today, you can track and log symptoms not just for yourself, but for up to 10 people in your household. I think this is a terrific thing, especially if you're sending your kids back to school or the family's getting a little bit more active and you want to check and log symptoms for everybody in your household. This will allow you to do that for up to 10 people. I'm also excited to announce that we're launching a new contest this Friday. I'm asking you now to please download the Crush COVID app and complete your symptom diary for 7 consecutive days. So download the app, fill out your symptom diary, which will take you 10 seconds, do it for 7 days in a row, and then you're eligible to enter a contest to win a night stay at a Providence hotel. The Renaissance Hotel, the Dean Hotel, and the Hotel Providence each have donated to us a night's stay, and so we're going to have a contest. The details of that contest will be made available Friday from the Commerce Department. Keep an eye out on social media. It will let you know how to get more information. It's a fun thing to do. You might win. You might get a night away for free in Providence. And it's just a way that we've come up with to try to encourage everybody, download the app, and just get in the habit. Get in the habit every day of checking your symptoms. That's what we all have to do. We've gotten into the habit of wearing masks. We've gotten into the habit of keeping a distance. Now we want to really get into the daily habit every day. Check your symptoms, check your kids' symptoms, track it, log it, and keep each other safe. Okay, switching topics, I want to take a second to talk about nursing homes. Obviously, nursing homes have had a very, very difficult time during the coronavirus, and the virus poses a severe risk to folks who are older, who are sick, who are frail, and who are in communal living arrangements such as nursing homes. As a result of that, we have had to have extreme restrictions on visitation to our nursing homes. As hard as that has been, it has what's allowed us to keep people alive. We also provided more than $75,000 to nursing homes to provide iPads and other electronic devices to allow residents to communicate electronically with their loved ones. But anyone who's ever FaceTimed with mom or dad knows there is no substitute for that in-person visit, for being in person with a loved one, letting them see you, and being there with them. So earlier this summer, we began allowing in-person visitation at all of our nursing homes and assisted living facilities. And I do want to say a huge thank you to nursing homes, most of whom are doing an incredible job under very challenging circumstances. Having said that, it has come to our attention that some homes have not been allowing visitors or have not been allowing enough visitation. And others have not been allowing visitors because of the guidance that we had in place, which stopped visitation once a facility had a positive case. So last week, in order to address this and to enhance visitation, last week the Department of Health sent updated guidance to all nursing homes that if a new case is identified, so there's a positive case in the nursing home, visitation can still continue for non-infected asymptomatic residents and those not required to be in quarantine. So the bottom line, and we want all nursing homes to hear this, and assisted living, the bottom line is that a single positive case is no longer a reason to completely halt visitation at a nursing home or assisted living facility. The Department of Health in that guidance also reiterated that nursing home and assisted living facilities need to make every reasonable effort to ensure that residents and their families have access to regular in-person visitation. Unless the facility has been expressly directed to stop in-person visitation by the Department of Health, they must work within the guidelines to make visitation possible on a regular daily basis. Now, that doesn't mean we're relaxing guidelines to a point that we want the infection will spread again and make, return us to the challenges we had before. The facilities have to have a process in place. The process for visitation has to comply with the Department of Health guidelines, which are still strict. But it does mean that at all times, nursing homes and assisted living have to allow for remote and virtual visitation and also in-person visitation. The Department of Health put the guidance out last week. As I say, most of you are doing a terrific job. For those of you who aren't, we ask you to please do that, consult the regulations, and open up for visitation. Okay, switching gears for a second, I want to talk about the flu. Not coronavirus, but the flu. Soon, we're going to find ourselves in a situation where we are dealing with both the coronavirus and the traditional flu. This flu season, vaccination for the flu is more important than it has ever been. I cannot emphasize this enough. This is truly a life and death situation. Please, everybody, now, make a plan to get your flu vaccine. good news, Rhode Island does very well typically. In a typical year, in Rhode Island, in an average year, about 55% of adults get their flu shot and about 75% of kids get their flu shot. That makes us number 2 in America in terms of flu vaccinations. So we're at the top of the list, but still it is not nearly enough. That is not enough to get us safely through the winter. 55% is not high enough. 75% for kids is not high enough. Because at those percentages, it still means that hundreds of thousands of Rhode Islanders don't get their flu shots. And in a world where we are dealing with the deadly disease of COVID combined with the flu, we cannot have hundreds of thousands of Rhode Islanders not vaccinated for the flu. So let me tell you what we are doing. Our primary goal is to make it easier than ever this year for you to get your flu shot. We are building on the great work that the Department of Health has been doing for a long time. We will be partnering with schools so kids can get their flu shots in school. Same with teachers. We're using our health equity zones to bring flu shots into communities, particularly densely populated cities. We're going to be relying on community organizations that are in communities, nursing homes, cities and towns, grocery stores. We're going to come into the community like we never have before. You will have no excuse not to get a flu shot this year. We will be in your community. If you can't afford it, it will be free. If you don't have health insurance, it will be free. We will be coming into the community, partnering with grocery stores. When you go to, if you're asymptomatic for COVID and you show up to get your test for COVID, if you have no symptoms, we're going to offer you a flu shot right there on the spot. We may do a similar program we did with Stop and Shop and just come right to you. And obviously, of course, you should call your primary care doctor. You can go to a local pharmacy. You know, all the ways you typically would get your flu shot, going to a pharmacy, calling your doctor, going to your health clinic, do that. But if for whatever reason you don't have a doctor, you don't have health insurance, you're busy, you can't make an appointment, we're going to make it easier than ever for you at your school, in your community. When you go get your COVID test, if you don't have symptoms, we'll offer you a flu shot right there. We've ordered 150,000 more doses of flu vaccine this year compared to what we usually do, and we're ready to get more. We've ordered an additional 150,000, and we have an ability to get more if we need to. While many pharmacies have flu vaccines already available right now, the flu vaccine that the state buys should be available at doctors' offices within the next 2 weeks, and clinics shortly after that, health clinics shortly after that. So we will continue to talk about the flu vaccine over and over again. It's not just about keeping you safe, it's about making sure our hospital system doesn't get overrun. One of the biggest risks in managing the coronavirus is making sure that our hospitals and emergency rooms don't become overrun, overwhelmed, and overfull, which is happening, continuing to happen now in places like Texas, Arizona, other places. The hospitals are full. They're struggling to staff the hospitals. Thank God that hasn't happened here, and it's not going to happen. But the combination of the COVID virus with the flu could cause us real problems this winter if we don't have everybody getting their flu vaccine. So even if you don't typically get it, I'm asking you please this year to do it. It isn't just for you, it's for everybody in Rhode Island, so that when you go to the emergency room, for whatever you go to the emergency room for, you can be seen by a doctor and it isn't overwhelmed. So that when mom and dad needs to go to the hospital, there's a hospital bed for them because our hospitals aren't overwhelmed. So again, we're going to be a broken record on this. 55%, which is what we typically do, is not nearly enough. Think about it now. Think about it now. We'll have the state flu vaccine available in a couple of weeks. Think about it now. How am I going to get myself and my family vaccinated? Because it's incredibly important. Finally, I just want to talk very briefly about schools. A lot of you obviously tuned in last week. Many of you didn't tune in last week. But just as a brief recap, we have cleared every school district for in-person school except Providence and Central Falls. So what that means is that beginning next Monday, September 14th, schools will start. Everyone's been cleared for full in-person. Schools are going to ramp up to the full in-person between September 14th and October 13th. Every parent still has choice. You can choose if you want to do full in-person or if you want to do distance learning. And I know a lot of children, students have underlying health conditions. Maybe you live in a family with people who have underlying health conditions, so if you want to choose distance learning, that is your right, and we're going to do our best to provide high-quality distance learning. But for everyone else, school starts Monday, and every town except Providence and Central Falls has been green-lighted to return in person. As I announced last week, the state has set up a separate testing and contact tracing system just for K through 12 education. Starting Monday, as of Monday morning, we will have set up and have operational more than a dozen testing sites all around the state entirely devoted to K through 12 testing. A full list of those sites will be posted this Friday on the Back to School RI website. And all of those sites will be fully operational starting Monday morning. We'll have the capacity to run more than 5,000 tests a day just for the K through 12 system. And beginning September 14th, anyone who feels sick during the school day, teacher, employee, student, anyone, will be able to immediately receive a rapid test with same-day results and a more definitive PCR test with results within 48 hours. So the bottom line is that we'll have all the systems in place by Monday in order to contain an outbreak before it happens and also minimize disruption in learning. This Friday, in addition to releasing the 12 testing sites, we're also going to be releasing the COVID K-12 testing hotline. We've made it so that there's a single phone number. If you feel sick or if you have to get tested, you call one phone number. That number is going to be released on Friday and communicated to every school district, every school, and we're going to blast that number out there. As a reminder, if you wake up feeling sick, we need you to call that number so you can get your child tested. If during the day you feel sick, the child will be sent to the isolation room, tested, and the same number will apply. As a reminder to the kids, you're going to have to wear masks in school. Please, if you can, parents, buy the kids a couple extra masks. We, of course, will have masks in school, as I am sure some kids will forget or lose their masks. Whenever possible, learning and lunch is going to take place outside, and we're going to do our very best to have some sports. Soccer, field hockey, sideline cheer are happening with some restrictions. Football and volleyball are not happening. They're going to be moved to the spring, and tennis and cross country will be happening essentially with very limited additional restriction. I will say getting back to school in a pandemic is hard work. So to everybody out there who's worked so hard, I want to thank you. To those of you who are a little bit nervous, I think we all are, but I have confidence in our systems. We've learned a lot. We know how to do this. We know how to get these kids and teachers in school safely, and that's what we're going to do. Finally, I know students have a lot of questions, so tomorrow For our 8th and final back-to-school forum, I will be joined by Dr. Jim McDonald from the Department of Health and Barbara Cottom, the chair of the Board of Education, on my 3 o'clock Thursday Facebook Live. We're dedicating the entire half hour to answering questions from students. Students have submitted many, many questions. We're not going to get to all the questions, but I'd encourage you, if you're a student or a parent, to tune in. I'll be there with those two folks tomorrow, 3 o'clock, answering the questions from our kids.